many new patients do you need? I would submit that the answer is far less than you think it is. Seems we're getting a lot of questions these days from doctors asking us how can we help them get more new patient flow for their practices. When we ask them, why do you think you need more new patient flow, they tell us because their schedules are light, their treatment schedules, they need more productivity. Well, we've been pulling patient records for over 34 years in practices around the United States and Canada in 12,000 practices. And we compare the service rendered record to the patient chart to look at how much treatment is actually delivered based on what the doctors recommended. And we have a surprisingly low answer. About 47% has been our findings of the treatment that's recommended to patients who regularly visit these practices is actually delivered to those patients. So that seems to create a need for more new patient flow in the doctor's minds. Well, I would submit that their time would be better spent looking at how can they get inside the patient's mind and understand psychologically how do they make decisions about dentistry, and see if there's in some way that we can motivate more of these patients to accept better treatment. The more you get to accept, the fewer new patients you need. In fact, we can determine how many new patients any particular practitioner needs based on what their treatment acceptance rate is. And our findings, what we're striving for always, is the minimum number of new patients that allows us to optimize the amount of time spent doing surgical restorative treatments in the doctor's schedule. After all, examinations don't get patients healthy. It's only when we can deliver the treatments that we discover in the examinations. There's always this balancing act between how many examinations you do versus the time then spent doing the actual restorative procedures. So I would hope this information is useful. Think about how you can improve your skills in gaining better treatment acceptance and spending less time and money and effort on how do I get more new patients in the door. Thank you, and I look forward to seeing you again next time.